least 2 more hours and keep up her fluids. So once she started continuing breathing that oxygen, she actually started feeling better. And so Dan advised that they could get the diver to a local clinic and hospital for review, and so she could continue breathing oxygen. Now, the local chamber operator was aware of the case and that they would be ready on hand to recompress if the diver needed it. Now, the good news for this diver is that breathing oxygen completely resolved the rash, but she still had some residual pain in her abdomen and in her hips and chest area. The Dan medic requested another 2 hours on oxygen. When, with the rash not reappearing, the pain resolved, the diver felt better, she did not need to be recompressed. So that was a good outcome for this lady, where the oxygen completely resolved her symptoms and she could continue on her holiday without having to go into a chamber. It's a win for everyone right there. She was advised not to dive for 6 weeks, and she was advised not to fly for a week. Yeah. So I'll pass on to Mel now for the second case.
So in our next case, we speak about an incident in Indonesia. So this was a 32-year-old male, completed 2 technical dives to 40 metres for 25 minutes and completed 25 minutes of deco. So upon surfacing, he felt weakness and was given oxygen first aid for 25 minutes, a little bit short in my opinion, but it's a start. His symptoms resolved. However, when he stopped breathing the oxygen, the weakness returned, and he also developed other pain, so elbow and shoulder pain. So the symptoms started to evolve and sort of progress and get a little bit worse then. So when the call came into the Dan hotline, he had been back on oxygen for an hour with some minor improvement, which was great. So likely to be experiencing DCI, the diver was advised to present at the local hospital for evaluation and possible recompression. So he arrived at the hospital and he was symptom-free. And that was because he had breathed oxygen for the 4 hours that it took him to get from the dive site then to the hospital. And that's great. The fact that they had oxygen, that he could be breathing for that entire period, made a real significant difference in this case. And that again highlights what we've been saying. The power of oxygen is just amazing. And the more that you know about that, the more that you're aware about that, the more you can demand that should you find yourself in a similar predicament. So the hospital at this point now was not certain that he had DCI because he wasn't presenting with any symptoms. So he was given more oxygen at 10 litres per minute and hydrated with fluids. He stayed in hospital that night, and when he was reassessed the next morning, he was asymptomatic, so he was there for discharge. So that's great news. Again, he avoided having to go into the chamber. And given that he was doing technical dives, it could have been a lot worse. If he didn't have oxygen for all those 4 hours, he very likely would have ended up seeing someone like Max. So he was refrained not to dive and, of course, to be assessed by a diving doctor before getting back in the water. Now, you might think that because we work out at Dan, that nothing ever happens to us, that we're immune from any diving incidents and we will never find ourselves in a predicament or feeling like you might feel, confused and unsure and confronted with that situation of perhaps not being provided oxygen or having to be at the mercy of an operator. But we're here to tell you that it does happen to us. And Miss Amelia has found herself in that very position, and she's going to share just a little bit of information as it relates to what we're trying to share about the oxygen first aid.
So my story is one of denial, of lack of knowledge, dive operator, and a story about what happens when you need oxygen and the dive operator doesn't necessarily understand what the correct flow rates and equipment is. So I'm not going to go into details about the dive. I'll set the scene though. It was in Indonesia, in Bali, I did a series of, the plans were to do 3 dives per day for about 3 days, all within recreational limits, all very easy diving. So after day 1, did 3 days of diving, 3 dives for the day, came back and had a little bit of an itchy rash on my abdomen. Put it down to, I get very cold in the water, so I was wearing a shark skin with a 5mm wetsuit, so I thought, oh, perhaps I just got a little bit of irritation. I felt fine. I didn't say anything. Next day, same thing, did 3 dives, came back from the last dive, felt very, very fatigued, and I noticed a bluish, mottled, coloured rash on my abdomen and on my upper chest area. This doesn't look right and I don't feel right. So I went to the dive operator, the resort, lovely resort that I was staying at, and I said, what do you think about this? I feel like something's happening. I don't feel right. And they said, oh, miss, it's okay. You've just got a little bit of skin irritation. You'll be fine. And I thought, I don't know. And my dive buddy that I was with, she's a dive instructor. She goes, no, look, you're fine. You know, you'll be right. You're probably just really tired. You've come, you've had a long flight from Melbourne. You're doing 3 dives, trying to acclimatise to the warmer weather. Thought, okay. Next day, went diving. Did 1 dive, and you're going to be horrified, Max. And my rash was just all over. And I thought, no, something's wrong. Again, I went to the dive operator. I said, look at this. This isn't an allergy or a rash or irritation. Stop being a princess, Amelia. You are fine. Come on, you've got 1 more dive. I said, no, I can't. I said, something's wrong. So I called Dan. I explained my symptoms, and they said, do not dive. Get on some oxygen. So I went back to the dive operator, and I said, I need to go on oxygen. They've said that they suspect, given my symptoms, how I'm feeling, and this rash, that I have a decompression illness. I have a skin bend. They didn't know what I was talking about. I had to explain what it was, and Max, you can probably go into more detail about. I was trying to tell them about the nitrogen bubbles accumulating under my skin, and they had no idea. I said, look, I need some oxygen. We had to look around for the oxygen. Then they found, I said, I need a mask. I need to attach it. We have to put it all together. And I'd done an oxygen provider course with Dan, so I knew exactly how to put together the oxygen equipment, and I knew exactly which mask I required, which was the non-rebreather mask. So we're looking around in this office area, and they gave me nasal prongs. And again, Max will talk about why the delivery of oxygen through nasal prongs is not the right choice. So I said, no, I need the NRB mask. I was trying to explain. I said, let me have a look around. And I'm sort of, by this stage, I was in trouble. I was actually starting to feel quite unwell. My denial had kicked in because everyone was validating, no, there's nothing wrong with you. And I started to feel like I was making trouble as well. And it was all just, I was falling apart at that point. Then finally we found the correct mask. I put it all together. They put me on 4 litres of oxygen. I said, no, that's not.
The wolf, she cries at night. A breath had born in the black wind where the shadows lie. Deep inside despair, our hearts grow fierce, our minds aware.
Of breathing in that oxygen, my rash was disappearing before my eyes. the rash that was on my upper chest area, I could see it shrinking. My mind started to clear. I started immediately feeling better. So I sat there breathing oxygen for 1.5 hours. Then Dan called me back. How are you feeling? Because that's what they said in the initial call. We'll call you back in a couple of hours once you feel, go and find some oxygen. And they said, continue breathing the oxygen. Because I said, I felt immediately better. So I did that. I continued breathing oxygen for about 2 hours. And I felt amazing. Like, it was the result of just that small amount of time on the oxygen was incredible. Now, the discussion then with Dan was, we think you should go to a chamber if your symptoms do not improve, or if when you're breathing on air, the symptoms return, you have pain again and so forth. And they said, obviously, do not continue diving. It's a big no-no for you. Anyway, I made the decision. I was going to continue breathing oxygen, and I was going to enjoy the rest of my holiday. So then part of that discussion was, once we looked at my dive profiles, they didn't feel like there was anything provocative, because I said, what did I do wrong? I immediately thought I did something wrong. And they said, you didn't do anything. It doesn't seem like you've done anything wrong. And they said, you could have a condition called PFO, which is a congenital heart defect, where there is a hole in the middle of your heart that doesn't close over after birth. That could have contributed to this. So when you go back home, make sure you go and get a referral and have it checked out. So, and they said definitely no more diving until you can pinpoint what's actually happened here. Now, for me, that to me is the most dramatic thing for me was when I went back home, I actually had a very large PFO. It was 5 millimeters, plus I had 2 other holes in my heart that I never knew were there. So I had a major atrial septal defect that had to be closed. The cardiologist said, for me, there is no safe level of diving unless you have that closed. So that's what I did. Now, had I continued diving, my next dive would have been down at Crystal Bay, which is, well known for currents and a little bit more challenging. The outcome for me would have been very, very serious. With knowing that I had that defect, so that was, one of my, sliding door moments. Not continuing diving, listening to myself, not listening to the dive operator, challenging the dive operator as well, saying, I know there's something wrong with me. So for those dive operators that are out there in the audience listening to this, do not discount someone's symptoms, right? If they're saying they don't feel right, call Dan. Dan is there as your resource. They're the experts. Call them. You're not a clinician, you're not a dive medic, you call them for advice. Similarly, divers out there, you know your body. You know when you don't feel right. So question it. Call Dan for advice. That's what we're there for. So that's my story. If it can happen to me, it can happen to anyone. Right? I didn't know I had this birth defect. So the good news is now I'm anatomically normal.
And we can use her at all dive shows to tell her story. Win-win. Thanks, Em.
Yeah.
Thanks for sharing, Em. Appreciate you sharing that with us. So I'm going to pass you over now to Max to speak about the serious stuff, to really speak through how oxygen helps, to really talk about those flow rates that Em mentioned when she mentioned it was low and needed to be a lot higher, and also the different types of masks, because they also make a big difference and will also empower you when you are out there, should this happen to you. Max?
Yes, sure. One of the biggest, this is a really crazy story first. you got oxygen 3 days after you started to have symptoms, and it solved it in 30 minutes. And this is not the first time I hear something like this. Most of in the chamber where I work, which we have a lot of calls, we are only doing diving emergency. We don't do anything else but this. And we often, I love those calls, which is like, I have a problem on a boat, something is happening, somebody has issues or cannot, different degree of problems. We put them on oxygen right now, and by the time I arrive to hospital and they are there, they are symptoms free. Magic, absolutely magic.
Magic.
What's happening in there is that the oxygen, the saturation of oxygen, by forcing out oxygen in our body, we can eliminate extremely fast nitrogen. What I hear a lot of the time is, oh, this is is it dangerous? Will I die if I take oxygen? Actually, the medical that you do before diving also screen for the use of oxygen in case you have any kind of a problem that you will be receiving oxygen. Receiving oxygen for you is 100% safe. This is I can't put it enough, it's 100% safe. It's also, oxygen is gonna help you pushing away the nitrogen, but also gonna make you feel better immediately. If you have a bit of blockage here and there, it's gonna help, and it's gonna help also reviving those tissues that may have already started to have damage. It's gonna help them heal and also go back. Obviously, independent of the cases, sometimes when we stop oxygen, the symptoms can come back, and this is generally an indication for hyperbaric recompression treatment. But it doesn't mean that because you have oxygen or you have hyperbaric treatment that you have to stop diving. I was in a hyperbaric chamber at the beginning of my career. I missed 45 minutes of deco. Oopsie. Equipment failure. I was in a very bad spot, and at that time the operator I was diving with decided to send me directly. Got recompressed for this, and this was 5,000 dives away, and I've been diving, and I've been very lucky that I never had much more problem. But I also see, from experience at hospital, the extreme benefit of oxygen being given to people fast.
Oh, I don't know. Am I on to the next slide? Yeah, flow rates.
So flow rate. Flow rate is very important. The kind of mask you're going to be using is also going to be extremely important. In general, you want to give something that is going to have the highest amount of oxygen in the body, mostly non-rebreather mask, demand valve as well. If you're on a take diving boat and you have take divers around, they for sure have either 100% oxygen, nitrox 80. So if you run out of oxygen for some reason, first give them the highest flow rate you have. This is much more efficient to give 10 liters per minute, 15 liters per minute, and run out of oxygen than giving 2 liters per minute at a small rate for longer. Yeah. We want this hit, this bunch of oxygen coming through, more than having a teeny tiny amount over a longer period. Also, if you have on a dive boat, you run out of oxygen, you have take divers, use their nitrox. Even if you have nitrox 32 on demand, it's better than nothing. This will help at the end. Mm-hmm. Yeah. So nasal cannula, this is a mask that has been mostly done in daily care that you might see. Unfortunately, the percentage of oxygen you inspire, you get from the mask is only a little. It's 40%. So you take from 100% oxygen, and you get at the end only 40% of it. It's just not enough. I know some kits you may have them, but it shouldn't be your mask of choice.
Yeah, look, why would they even have nasal cannulas at dive centres?
Just because they come from some kits. Sometimes people buy them in bundles, right. And then they come with 5 different masks, and they're like, oh, this is a nasal cannula. We shouldn't use it, but we have it in case.
Right.
but it's not supposed to be here.
And as you said, Em, that's what you were provided.
Exactly.
So,
Yes.
as we say,
You're off.
with a nasal cannula, say no.
It also depends where your oxygen kits come from. So if like oxygen is oxygen at the end, right? Like if you get it for, you can get it for divers, but you can also get it for people that have like troubles breathing. In this case, you will have a nasal cannula with a lower level of liter per minute. This is not meant for diving emergency. It's great. It's already a good step in the right direction, but it's not where we should go. This is a great mask. It's pretty much like a scuba mask, but it just connects to your oxygen tank. It's great when your patient is breathing and responsive. So if your diver that is in a situation, in a trouble, is still breathing, conscious, and can use it on his own, it wouldn't be the best choice in case your diver is unresponsive or non-breathing. But luckily, or emergency most of the time are those. So this is great to have on a dive boat. The non-rebreather mask is, I think, the best mask you can ever have anywhere. Even though it's a bit lower in terms of oxygen delivery, it can be used for people that also have issues breathing, or if you need to do CPR to someone, it can be used. You can connect them to pocket mask directly, and it's actually very helpful for you.
Yep.
Thank you, Max. Thanks for sharing. So just to do a quick summary then, next slide please, Em. So maybe take a photo then of this slide too. So for oxygen first aid to be effective, it needs to be provided early at the very first onset of symptoms. Don't delay. There's absolutely no reason to delay. As Max said, there is absolutely no harm. There's a lot of wellness centres out there now who do oxygen therapy, so there is absolutely no harm to you. So don't let someone talk you out of needing oxygen delay. It needs to be at the correct flow rates. It cannot be at 2 litres per minute. It must be between 10 and 15 litres per minute in order to be effective. You need to use the right mask. Say no to nasal prongs. Max has shared with you the correct masks to use. You know what to look for. You know what to ask for. You can even take your own masks with you on trips. And it needs to be provided until medical attention is sought, and this is likely for several hours. As we've seen in the case studies that we presented, someone breathed oxygen for 15 to 20 minutes, the symptoms resolve, but then they reappear. So in order for it to be effective and to fully reduce symptoms, it needs to be for several hours most likely. There's no harm again in breathing oxygen for several hours, and you don't need to have any air breaks. So these are the really critical factors for you to have to empower yourself with this knowledge and take that with you. And I'm going to pass you over to Em now to explain what you need to look for when choosing an operator moving forward.
As divers, we also have our own personal responsibility. It's not always up to the dive professional or the dive operator to do the thinking for us. So before booking your next trip, ask the operator, do you have oxygen equipment? What type of supply of oxygen is available? Do they have oxygen kits on all their boats and at all their sites? Are their staff actually trained in oxygen provider? Can they administer oxygen first aid? And do they have an emergency action plan? If they don't know what that is, then they don't know. Perhaps rethink your decision to dive with them. No, but also Dan can actually help all dive operators create an action plan. That is a free service that we offer all dive operators who need a little bit of help or need advice onto what to actually put into that emergency action plan.
Oh, yep.
One very cool thing about this, you saw earlier about expedition diving. I call down when I need to know what to do, when I'm not sure where I need to find critical information. I also call down actually to find out sometimes where where to go and where are the nearest emergency services for chambers, etc., etc. When I need my own action plan in the middle of the mountain, they are in general extremely good at giving me information and what to do. So I'm also using this personally in my expedition.
Thanks, Max. And Dan is a service here for the community. We are the only diving health and safety organisation out there, and we encourage you to use our services. The website has an extremely huge range of information, and if we don't cover what you need us to cover, just ask us. Dan is all about educating and learning more and trying to constantly improve as well. So, can we go back one slide? So, while we know that oxygen really does help, it doesn't mean that it's going to resolve everything. We're not saying that oxygen first aid is going to keep you out of the chamber. If that was the case, Max wouldn't have a job, and we want Max to have a job. So what we do want to talk a little bit about now is the chambers. You can go next one.
It went on its own before and now it's
And just cover off a few things to be aware of on that front. So Dan doesn't share chamber information. So with our members, it's not like you join, become a member, and we just give you a list of chambers and say, sort yourself out. We don't want divers just turning up to chambers. We have had it before where divers have bypassed perfectly good hospitals and clinics and gone straight to a chamber only to find it closed. So therefore, they've now extended their delay in receiving treatment, which is problematic all round, because it probably means now they need to have further treatments when they could have resolved it by going to the hospital and even just starting to breathe oxygen at the start. So we want you to get evaluated at a hospital or emergency clinic. The physician needs to rule out other conditions and illnesses such as a heart attack. Things can be confused with decompression illness. We can't always assume just because we've been diving that it's automatically decompression illness. So that's another take-home message then for you. Hospitals have advanced diagnostic procedures that can rule out complications, such as a collapsed lung, which does happen, and other factors that could make recompression inappropriate and even dangerous. So I'll pass you over to Em, and she'll just chat a little bit about the chamber capabilities.
Okay, so not all chambers, not all hyperbaric facilities can deal with all cases. So the closest chamber may not be the most appropriate. A chamber's status can change. They can close for maintenance, there could be staff shortages, they could have high patient loads. There's a variety of reasons why chambers cannot receive divers at any time. So prior notification from a facility is usually necessary to begin the staff call-in procedure. And that's so that it allows them time to actually call in the appropriate staff to deal with the situation. So we have seen several cases where divers have driven past healthcare facilities, as Mel just mentioned, to get to a chamber only to find it's closed. And again, I guess we're trying to reinforce the correct procedure is to avoid delays in treatment and to avoid worsening your symptoms. Just call Dan. Dan has the live list of the chambers that are operational and receiving divers. So just call Dan. You only have to make one phone call. That's all you have to do. And then Dan will take care of the rest.
So just a little bit on the hospital capabilities. So unlike most freestanding hyperbaric facilities, hospitals, of course, have advanced diagnostic capabilities. And that's what you want when you're experiencing something we're not sure about. We want to make it clear what you are experiencing and treat it appropriately. It's a multidisciplinary setting with proper diagnosis, and we want a patient to be stable before they do enter a chamber. Hospitals and urgent care facilities have a virtually unlimited supply of oxygen, intravenous fluids, and medications.
So when in doubt, just call Dan. The message is really simple. We have a hotline number. We keep saying it over and over again. It is the one call that you need to make, and you're straight through to a dive medic. Dan maintains the database of hyperbaric facilities willing and capable of treating you. Once you've begun administering the first aid and activating your local emergency services, Dan can help you. So together with the local authorities and the local hospital or treating facility, they can determine the best course of action for you. Now, if the need for recompression therapy seems obvious, Dan can confirm the chamber availability. But Dan is not the only resource for chamber information for travel abroad. Your dive operator should be able to give you this information before arrival. And that is also part of their emergency, that should be part of their emergency action plan. Your dive operator should know where the local closest medical facility is and where the closest chamber is as part of their action plan. If they don't know it, I don't know.
That's a problem.
Yeah.
Now, we only have a couple of minutes left, but with Max being here, I thought it'd be great if he just provides a little bit of an insight should you need to present to a chamber and what actually happens, because I'm sure it's scary. Most of us haven't been to a chamber and had to receive treatment. But Max, can you just tell us a little bit about what it's like when a diver does present?
Sure. So, 2 minutes of a chamber overview. It sounds more scary than it is. Like, it looks like what we see here in the back is a monoplace chamber. The one I work in is a multiplace. So I'm in with the patient. So I do the complete treatment with them, except I don't have the oxygen. I'm just breathing normal air, making sure that everything is doing fine for them. It's the treatments, the standard of care is called what we call a table 6, which is roughly 4 hours, 45 minutes. We go down to an 18 meter for around an hour, and then we come up safely and we spend a bit of time at 9 meter. The idea between those two phases, the first one is to make the bubble extremely small and break them, and the second one is to promote the healing effect of oxygen in the body. One thing very magic that happens in a chamber that cannot happen anywhere else in the world is as soon as we go down and we breathe oxygen, not only our hemoglobin, which is what we all use here to transport oxygen, but our plasma gets saturated with oxygen. And this is using this liquid, this plasma that we have in the blood, that irrigates all of our cells that actually arrive to promote cells regeneration, also go away blockage. So it is very, very beneficial. Nothing wrong is going to happen to you if you go in a chamber. As I said to you earlier, I went there in a patient, and I'm going there quite often as a medic. There is no side effects except that it is a weird dive. It's a boxy dive. It's a bit hot. It's a bit if you get food with you, because sometime in chamber you need to eat. Food tastes extremely weird. But it's not the most pleasant experience in the world. We have to equalize the same way we will go for a dive, a bit more often actually than in a normal chamber, than in a normal water. But once everything is settled, it's literally just it's quite easy. It's just as long as everybody is calm, everything is there. We have Netflix. We can watch some movie in there. We have so it's pretty. We try to make it as nice and as easy as we can for patients.
Because you're already so stressed, like having to go into a chamber, like the diver would be so stressed and anxious. So having that environment that's a little bit more relaxing.
Netflix helps, yeah. Yeah, I mean, it's also not being alone in a chamber.
Yeah.
It helps a lot. We try as much as we can. So when we have an emergency, the first thing we do is obviously, even us, we look into the provider of the person. Most of the time, Dan is the provider. So we have an excellent relationship with Dan. And even me personally, I have called Dan for me a few times. But we don't only decide, like the chamber is a medication at the end. You have to see it as a medication. So we have a physician that is going to prescribe a chamber treatment. We are doing this with physician that knows, hyperbaric doctors that knows this, and we try to work all together into the safety of the patient. But generally, my job starts from when there is an accident. Even before we call down, I'm also present at hospital when there is an assessment. Even though most of the time it doesn't end up in the chamber, we take every single case and we look into every single person like they are all on. And we've done, it's really nice because we do have access to medical professional, even if sometimes we have very weird cases. So something we are like, even highest doctor are not sure. We have access to a pool of physicians that are absolutely amazing and help us getting the best decision for the treatment of the patient. So
That's great. Thank you, Max.
Pleasure.
Really appreciate it. Now we're out of time, so just to quickly sum up, Dan is a service available to everybody. So while all divers can call Dan for advice, we can only arrange an emergency evacuation and pay for dive accident treatment and the evacuation, of course, for our current Dan members. So if you would like to learn more about Dan, please come and visit us. We're at booth A185, 187, just behind here. And also I just want to highlight that we do have a range of hotline numbers that all divers can call. And we have local hotline numbers. One for Malaysia is 015 4600 0109. We give away these hotline stickers and tags. As I just said, anybody can call Dan for advice. Come and collect one from us. Have these numbers with you and don't hesitate to call Dan should you need us. Thank you.
Thanks, everyone.
Thank you very much.
Right, thank you, Mel. Thank you, Melia. And thank you, Maxime. And there we go. Protecting divers one dive at a time. You can proceed to Dan's booth, which is located within the expo, yeah? Thank you. Right, coming up shortly, we're coming down to our next presentation. And it's brought to you by